Hi, my name is Brianna. I am the health coordinator here at Bridges. I have Miss Fong here.
Hello. And just because we want to be COVID safe, I'm starting with the mask on, but to be perfectly honest, I am basically family. We are around each other all the time, and so I am going to take it off so that those of you who might need to read lips in order to understand a little better, anybody hearing impaired that wants to see faces, can do that.
Yes. She is also a medical librarian, and that's the reason why she's joining us today. I'll be covering vital signs, hypertension, and emergencies. Well, let's jump on in.
Let's do that.
So with hypertension, to be diagnosed with hypertension, you're going to, usually when you're going to your doctor's office, either 2 consecutive visits. You'll notice that they take your vital signs at the beginning of each visit, and with that, they're going to tell you what your vital signs are. If they don't, you can always ask. But if you have 2 consecutive visits where your blood pressure is over 180, which is the normal blood pressure, they'll flag you for hypertension or pre-hypertension, and they can either start treatment then if they've taken it twice in the same visit and it's extremely high. We're talking 180 over 99. Even you can have triple digits on the bottom and the top for blood pressure.
Not a good thing.
No, those are what nurses call stroke numbers.
Stroke numbers.
Yes.
We don't want stroke numbers.
With those numbers, you'll see people have lightheadedness, you'll have fatigue with hypertension, just some different
Symptoms?
yeah, signs and symptoms.
Signs and symptoms. Okay, so the takeaway on that one is if I go in my doctor's office and my blood pressure is very elevated, they're going to say to me, hey, that seems high. And if it's very high, they'll say, I'm going to take that again before you leave, and they'll see if it's still high.
At the end of your visit, or even towards the middle of your visit.
So that's not really common for that to happen in one visit, though, right?
No, unless your blood pressure is extremely high, they're normally not going to retake it in the same visit. If they, for some reason, get very low numbers, you'll also see that they do the same thing with your blood pressure.
I am very familiar with low blood pressure. Let me tell you, that sounds like that could never be bad to have low numbers. They can be so low that you get out of your car when you get home from work, where you've been sitting in the car too long doing something on your phone, and you get out of the car and you drop to the ground, because I've done it. Yeah, so low blood pressure can also lead to not necessarily passing out, but certainly getting dizzy and falling down.
Lightheadedness.
If you're lightheaded, you hit your head on something, you fall. Either way, very high, very low blood pressure. Both are bad news.
Yes. With high blood pressure, if you're taking your blood pressure before you're taking your medicine, this is something that you'll do at home right before you take your morning medicine or right before you take your nighttime medicine. If you're taking your medicine a couple times a day, depending on how high your blood pressure is and what medications your doctor has prescribed to you specifically for your particular hypertension, you'll want to make sure that you get a blood pressure. Some of them have the home one where it'll do the blood pressure like you see in the hospital or in your doctor's office, and it'll blow up and it'll have a reading on the actual machine. They also have wrist ones that they can take. You can buy those at the drugstore, Walmart, that type of thing.
They look a lot like an Apple Watch.
They do, but they're extremely oversized.
Yes.
But you want to take your blood pressure, because if you take your blood pressure medicine before you've taken your blood pressure and your blood pressure is low, you can also cause yourself some more issues that way. Especially if you're just waking up in the morning and you take it and it's low, you'll want to wait till you've got up, start moving, got gotten yourself something to eat, and then retake your blood pressure and see if your blood pressure is starting to climb again. That way you can take your blood pressure medicine then. You don't want to drop a blood pressure that's already too low. Some other signs and symptoms with blood pressure are vision change. When you're having hypertension, you'll notice some vision changes. There are two different types of hypertension. Hypertension can either be primary or secondary. You can have primary hypertension where the reason why your blood pressure is low or high is because it's caused by your heart, or it's the actual cause of the hypertension. The blood pressure being high is the hypertension.
The hypertension itself is the main condition. You don't have a bunch of other things going wrong. You just all of a sudden, doctor says you have high blood pressure. That's primary hypertension.
Now, if you have a secondary condition that is causing the hypertension, that's considered secondary hypertension. If you have kidney disease, diabetes, you're a smoker, those are things that can cause the hypertension. They can cause your blood pressure to be high, which is the other word for hypertension.
Exactly. And so as Brianna is presenting all of these topics as we go on throughout the year, one of the things that you'll notice is that they are very closely related to one another. If you have a diabetes problem, you will probably see things about obesity, you will see things about heart conditions, you will see things about visual disturbances, all being related and interrelated in these conditions that people have. So what's primary and what's secondary, which one is causing which.
And that'll determine how your doctor actually targets treating your blood pressure. If they use a diuretic because you've got some kidney problems, and your kidneys can also cause hypertension, they'll treat you with normally some diuretics to reduce the fluid on your body, which also takes the pressure off of your heart, which lowers your blood pressure. They can give you, if you're just having the hypertension, they can treat it with a beta blocker or something called, there's a couple different medications. Honestly, I could get into it all day, but specifics are determined by your doctor. And they're going to be your best resource to find out why your blood pressure is high. It can be genetically linked. It could be gender. Men, usually when they're younger, they'll have hypertension. And women, you'll see us when we hit 65, normally we're the higher group that have hypertension. And so that's something to look at. The higher blood pressure, the more disturbances you'll see, such as the visual, the dizziness, you may feel some tingling even. I've heard some of my patients say that they feel some kind of tingling whenever the blood pressure is that high. But it's your own experience of what you feel when your blood pressure is that high.
Shortness of breath, dizziness.
Now to hit on...
Can I throw something in right here?
No problem.
Thank you. One of the things that pops up, we're going to obviously run into a lot of medical terms, and so that's kind of why both of us are here today. I'm not going to be a regular, but you've got a medical professional on your hands that is giving you information, and she's trying to deliver it in a digestible manner, and she talked about your doctor being the best resource for correct information, and that's always going to be true. If you've got a medical professional, your doctor is going to have the best information, but your doctor is probably going to say things like primary hypertension. What was one of my terms that I made a note on was hyperlipidemia, and there's terms that you're going to go, what? And dyslipidemia, there's things going on with the cholesterol levels. Oh, So the doctor is going to say these terms, and you may be afraid to ask what they are. Your nurse will tell you what that is.
If you ask and you explain to us that I didn't really understand what my doctor told me, could you break that down for me? And that's where I'll come in and I can tell you, okay, so if he's telling you that you've got dyslipidemia or high renin levels or angiotensin levels, those are things to do with cholesterol is going to be the dyslipidemia. Renin and angiotensin are going to be closely related to your kidneys. And those are terms that your doctor may use to describe what's going on with the hypertension. But if you don't know exactly what those are, sometimes that's what a nurse is there to do, is also make sure that you're understanding the information that you're getting from your doctor. If you tell the doctor, normally they'll also go in depth and break it down for you as well, but sometimes that can be intimidating, and that's why I'm here.
And sometimes the doctor is going from appointment to appointment to appointment, and you develop a question after he's already left that room. Don't be afraid before you leave to ask the nurses, I didn't quite understand this part. Ask them to explain that to you, and then if it gets beyond that, because some people will take that information and go home and it's on paper, and they're reading it and they're going, how on earth does my vision or my urinary system have anything to do with a heart condition? Well, your heart is called your heart for a reason. It is the center of everything, and what is going on with it is going to affect other things in the body.
And other things in the body can affect your heart.
Correct. Let me just point out then that even further down the road, if you get out of there and the nurse hasn't given you information, that's why the librarian is sitting here. You go to your library and you ask them for assistance to say, I got all this stuff from my doctor and I don't know what it means. And they're going to help you find good public information that is correct.
Yes.
And I'm going to tell you, anything that comes up in these conversations, this is why I'm here early in the year, anything that comes up in these conversations, if you look up the National Institute of Health, and particularly Medline Plus, MEDLINE Plus, Medline Plus, that is the government information center for solid, reliable medical information, and it doesn't have WebMD pop-ups trying to get you to join things and buy things. It's going to be solid medical information in layman's terms.
And they'll be based on facts. One of the other things that we'll hit on today is the other vital signs. Just kind of giving you a rundown of what the other vital signs are. Moving on.
Yes,
moving on from hypertension. So blood pressure, your normal blood pressure is 120 to 80, over 80. For the heart rate, it's 60 to 100 beats per minute, and you can count that over 30 seconds. If you can take a heart rate here, and you can feel here with two fingers. I always say piece to the pulse. And you take those two fingers, you want to leave your thumb out because your thumb can also offset the person's beats when you're looking for a beat. And you'll get your watch. If you don't have a watch, you can set a 30-second timer and you'll count for 30 seconds those beats, and you'll times that times 2, or you can count for the full minute. You can also do that at the carotid. You'll want to take your finger, you can go to the edge of the jawline, go over, and right about there, you can count for either 30 seconds or the full minute, and that's going to be your heart rate. You can also feel for the pulse there, which is the heart. For respirations, you'll count for 30 seconds. Normally, if you're counting somebody's respirations, for nurses, just a tip, we don't normally tell them that we're counting the respirations. We'll either count the respirations first or last when we're getting the heart rate, so that they don't know that we're counting their respirations, because respirations are voluntary, and so somebody will try to breathe differently than their normal rate when we're trying to get their when we're trying to get their respirations. So we normally don't tell them where exactly in our methods for getting vital signs that we're actually getting the respirations, because people will change their breathing rate. But the normal rate is anywhere from 12 breaths during 30 seconds or 16 breaths. Normal oxygen saturation is 95% to 100%. Normally for COPD patients, anything from 94 to 98% is considered normal, because COPD patients have to have a lower oxygen saturation. We have to make sure that their breathing, their O2 saturation is that low, because if we give them 100%, it could knock out their CO2 drive. People think that you
what
breathe.
What on earth does that mean? I have never heard of a CO2 drive, and I said CO2. O2. O2 is oxygen.
Oxygen drive.
CO2 is
so carbon dioxide.
So what I'm breathing out.
Yes.
Okay.
Your body does not breathe based on your oxygen intake. Your body actually breathes. The reason why you take a breath in is actually to get rid of the CO2. So you're breathing out mostly. If you
Gotcha.
So if you not,
I bet most of us don't know that.
Yes, the reason why you actually breathe.
That's why she's here.
You actually breathe is to get rid of the CO2. If CO2 builds up in our blood, it can offset our blood balance, which is our pH range, which is 7.34 to 7.35 to 7.45, I believe, if I'm being correct.
Very technical.
Yes. And so to get rid of the extra CO2 or acid in our blood, we breathe it out. And so that CO2 coming out is the reason why we take our breath. We'll then take a breath in, and that's beneficial for our blood too, but we have to breathe the CO2 out. You'll notice that if you're actually sitting in a room that is completely nitrogen based, let's say there's no O2 in this room, I would pass out and not notice that I'm not taking in oxygen, because as long as I'm breathing out CO2, my breathing is fine.
Wow.
That actually happened in NASA.
What's inside you that needs to get
come
out
is
the most important part.
Yes.
Okay.
And so they actually had a similar thing happen in NASA.
Okay.
Where they had pumped a what is it called? A spaceship or a room full of nitrogen, and they sent people in without pumping O2 in, and they passed out because they didn't know they weren't breathing in oxygen. They felt fine the entire time, but they did pass out because they were breathing their CO2 out of their body. That's a whole nother subject in and of itself.
We got off track.
That was a rabbit hole. Anyway, normal O2 saturation, if you're getting oxygen saturation on somebody, is 95 to 100 unless you're a COPD patient.
And then it'll be a tiny bit lower.
You'll notice that it'll be slightly lower. We're also going to talk about today what you do in an emergency situation.
What kind of emergency?
So let's say you find somebody that is unconscious. It's not going to happen very often, but let's say you do, on the off chance, come across somebody that is completely unconscious. You don't know who they are. It doesn't matter where it is. What is your first initial reaction?
I think it does matter where it is. If they fell down in the middle of the street, I think I'd move them.
Yes.
But you're not supposed to move people.
If there is a risk for, if you see somebody that is unconscious and there is a risk that they might have a spinal injury, the only reason why you move that particular person is if it's literally in a spot that is unsafe. So most
falling down in the street literally is the example.
Yes.
Okay.
Yes, that would be an example, especially if it's a major highway where the street can't be blocked off. Normally you'll move that person off to the side, because if you're on a highway, more times than not, somebody is going to hit another car on the freeway if it's stopped. Mostly because people are not paying all the way attention. It happens so often. You'll notice that Even officers will take and move you somewhere else if it's on a major freeway where that is definitely a risk factor, because they don't want your car to get hit, or they want you to get hit if somebody so happens to drift off and hit your car.
Okay, so I find someone who is unconscious, and gosh, I would call 911, but I wouldn't know what to do. So how does that work?
First thing you do, of course, is call 911, because you need somebody on the way. As you're calling, because the phones nowadays are mostly high tech, you do not need to take the time to get your phone ready and get in there and go, I need to call 911 and talk to them on the phone. Our phones can be put on speakerphone. We have Siri nowadays. We've got voice recognition. You would call and say, hey, Siri, I'm going to take the time not to do that because we both have phones that will...
We don't want to
we
call
don't want
911 when we say, hey.
do this. But you'll say call 911, and your phone can do that. You put it on speakerphone. You check that person for a pulse and to make sure they're breathing. Because as you're on the phone with 911, if they're not breathing, 911 can walk you through giving rescue breaths. They can, if they're not breathing, but they have a heart rate. If they don't have a heart rate and they are breathing, you would check again, and what is it?
I'm sorry, what were they doing? Were they not breathing, or was the heart not going?
So if the
that's
heart,
two different things.
So if the heart's not going and they're not breathing, you're gonna do both. Normally,
so the chest compressions are kind of right up.
So you'll do, usually what we'll do is we'll find the xiphoid process, which is the little bony centerpiece in the middle, and we'll take our finger and kind of wedge our hand up and close our hand, and that's where we're going to start chest compressions. But once again...
Okay, so there's the little bony thing you were talking about. I can feel it. And then the hand's going to go like that, and that's where those compressions go?
Yes.
Okay.
But once again, the rotation is you do 30
of these.
2 breaths. But once again, in the emergency situation, I could tell you right now that even if I told you, you're not going to remember. Because
nerves
in an emergency situation are going to get to you. The best thing to do is follow along with that 911 operator or EMS if they get them on the phone, because you're not a trained professional. You're not doing this on a regular day basis. I really don't want to get into how many breaths per minute, how many beats per minute that you're going to do, because this is not something you're going to remember in an emergency situation.
Correct.
You need to know the proper way to do it, which is finding the xiphoid process, which is the little bony part right there, taking your finger and just bending those in, and that's where you're going to go. In a child, it's different. I'm going
to tell you that I took a CPR class, and the thing that I remember is what you just said about this, and the thing that I won't ever forget is that someone started singing the Bee Gees song, Staying Alive.
That is one of the beats that we do, but...
because of the... timing, so you know you're doing it at the right rate, which sounds crazy, but they actually stood there and sang, staying alive, because they said that was the right speed. Depending
on who's on the phone, you might have that sung to you.
Okay.
If with the 911 operator is what I'm trying to get at. That's what I'm...
But you said it's different with a child. How is it different with a child?
You don't go as deep. For a child, you don't push
little people.
They're very tiny. You don't want to break their bones. But for an adult, you're going to want to go the full 2 inches in while you're doing the chest compressions. You have a couple different options. You can go like this while you're doing chest compressions. You can interlace, or you can lace just one hand. Those are the different options for doing chest compressions, and you want to go the full 2 inches on an adult. If they are obese and they are a little bit bigger, you're going to go a little bit deeper than the 2. Not by very much, maybe about 2.5 inches, maybe 3, depending on the actual size of the person, because your goal is to pump the heart. But back to the 911 operator. Those are going to be getting that person on the phone, making sure that you have EMS on the way, checking their breathing, making sure they're breathing, and checking their heart rate to make sure that they have a heart rate are the best things you can do in an emergency situation. If you find somebody unconscious, those are the main things, because once again, you're not going to remember in an emergency situation how many chest compressions to do per minute, how many breaths per minute to do, and the main things that I want to get at, because you can be coached over the phone how often to do those things. The main thing is making sure that you're checking them, getting 911 on the phone, and you can inform 911 as you're doing chest compressions, what is going on. I just found this person unconscious, don't know who they are, this is where I am, I need EMS on the way, I need to do chest compressions, I need you to walk me through it. And then you start your chest compressions. And if you have another person there, it's really, really good, because they can do the rescue breaths. But once again, making sure you get that 911 operator or EMS on the phone is going to be your number one thing for when you find somebody.
The terrifying part is, what if the person you find isn't a stranger and that's a loved one?
It is.
And that could be a terrifying situation and make the nerves even worse. But you've got to make that call, and they will walk you through it.
Mm-hmm.
And
sometimes it's not a stranger, but I wanted to give that information to you just because.
Well, it's the difference between life and death sometimes.
And
if you start early enough, you prevent them from
brain damage and organ damage.
Exactly.
Because the main thing is they have found, even with rescue breaths, is this is new research that was presented, is the longer you're off the chest from doing chest compressions, the less the blood is being pumped around, which is the part that needs to happen. Is making
That's
sure
what gets the oxygen to the brain is the pumping. And
so if you're not pumping, the blood is going nowhere. And so that's one of the main things, is making sure that you stay doing your chest compressions.
Not only that they'll survive, but that they will not sustain permanent damage.
Mm-hmm. The longer, yes. So
what else do we have?
That's actually kind of it for today.
I was going to say, I know I was a side tracker in a couple of situations, but
no, I've got to hit on the vital signs today. I've got to hit on hypertension today, and what to do in an emergency situation if you find somebody unconscious. Granted, there was a couple rabbit holes here and there, but the main thing is making sure that you get your information. If you have any questions that I didn't happen to answer in this video today, you can always leave a comment down below and ask those questions there. If you have any topics that you want me to hit on next time, you can always let me know also in the comments. If you look in the description, you'll find the survey from today, and if you have time to do that, I recommend doing that. That's how we find out if we're getting y'all the information that you need, and if it's actually something that you're liking, and it lets me know if this is the right track for these type of videos for you. Thank you for today, and if you leave those comments in the comment box below, I'll get to those as I see them come in, and I'll be checking that here today. Thank you so much, IT Communities. I'll be visiting you again next week. Thank you.